For best blood flow and least pain, sample at the side of the fingertip, not in the centre. Whilst lightly pressing towards the fingertip, prick the finger using a lancet. Wipe away the first 2 or 3 drops of blood. Reapply light pressure towards the fingertip until another drop of blood appears. When the blood drop is large enough, fill the microcuvette in one continuous process. If the cuvette is not completely filled, discard it and fill a new cuvette. Do not refill. Wipe off any excess blood from the outside of the microcuvette tip, making sure that no blood is drawn out of the microcuvette during this procedure. Look carefully for air bubbles in the filled microcuvette. If any are present, discard this microcuvette and take a new sample. Small bubbles around the edge can be ignored. Place the filled microcuvette in the cuvette holder. This should be performed within 40 seconds after filling the microcuvette. Rotate the cuvette holder to its measuring position. During the measurement, an hourglass will be shown on the display. After between 40 and 240 seconds, the glucose value of the sample is displayed. The result will remain on the display as long as the cuvette holder is in the measuring position. When operating on battery power, if the analyzer is not used, it will automatically switch off after approximately 5 minutes. Although all the reagents are present in the microcuvette in extremely low quantities, local environmental authorities should be consulted to arrange for proper disposal. Always handle blood specimens with care, as they might be infectious. To turn off the analyzer manually, press and hold the left button until the display reads "off" and becomes blank. When venous or arterial blood is used, appropriate anticoagulants in solid form, for example EDTA or heparin, and glycolysis inhibitors, for example sodium oxalate, sodium fluoride or potassium oxalate, may be used. To minimize the effect of glycolysis, measure the blood sample as soon as possible after it has been obtained. Mix the blood collection tubes well on a mechanical mixer for at least 2 minutes, or invert the tube 8 to 10 times by hand. For the correct use of liquid controls, follow the instructions of the manufacturer of the control material regarding storage, mixing and handling. Place a drop of blood or control material onto a hydrophobic surface, for example a plastic film, using a pipette or a specifically designed transfer device. Fill the microcuvette in one continuous process. Do not refill. Wipe off any excess blood from the outside of the microcuvette tip, making sure that no blood is drawn out of the microcuvette during this procedure. Look carefully for air bubbles in the filled microcuvette. If any are present, discard that microcuvette and take a new sample. Small bubbles around the edge can be ignored. Perform the analysis. The analyzer is designed to work for a long period of time without any direct service or maintenance. The analyzer should be cleaned according to the following procedure. Check that the analyzer is turned off. The display should be blank. Rotate the cuvette holder out to its loading position. Use a pointed object or your thumb to carefully depress the small catch positioned in the upper right-hand corner of the cuvette holder. Whilst keeping the catch depressed, carefully pull the cuvette holder in the direction in which the handle of the cuvette holder is pointing. Clean the cuvette holder with alcohol or mild detergent. The cuvette holder must be completely dry before being replaced in the analyzer. It is recommended that the cuvette holder is cleaned daily. The cover may be cleaned with alcohol or a mild soap solution. The optronic unit can be easily cleaned using the HemaQ cleaner. Push the HemaQ cleaner into the opening of the cuvette holder. Pull out and push in between 5 and 10 times. If the swab is stained, repeat with a new swab. When the swab comes out unstained, the procedure is completed. Wait 15 minutes before reusing the analyzer. Replace the cuvette holder.